Hello, dear students. Exam season is going on, and practical exams are going on, and there are many students who are not aware about how the exam is being conducted and what are the components of the community medicine practical university examination. I am Dr. Mohammad Shafi, Professor, Community Medicine, working at JIIU's Indian Institute of Medical Science and Research, Badnapur, Jalna, Maharashtra. In this video, we will discuss about the practical examination in community medicine. Those who are new to my channel, please subscribe my channel and like and share my videos. Practical exam in community medicine according to CBME, that is competency based medical education, is of 100 marks, and community medicine is one of the major subject in final MBBS part 1. So you cannot just study this subject in 15 days or 1 month. You have to study for 1 year. You have to prepare well community medicine because this is very useful subject for MBBS graduates. And also in PG NEET exam, there are many MCQs asked from the community medicine. Now let us see what is the practical exam scheme in community medicine. Already I told you there are 100 marks and the distribution of marks is like this. First is clinical social case will be of 20 marks, epidemiological and statistical exercises 20 marks, spotting 20 marks, skill assessment 20 marks, and grand viva 20 marks. So in some colleges, they are keeping OSPE for doing skill assessment, but some are giving you written scenarios and you have to write down the answers. So in this video, we'll talk about the spotting and the marks for the spotting are 20. So spotters, number of spotters will vary from institute to institute. Some keep 4 or 5 marks each, or some may keep 10 spots of 2 marks each. Like in our college, we keep 10 spots of 2 marks each so that there will be wide coverage of the subject. Each spot will be asked from one section. So these are the sections which are commonly selected for selecting the spot. Vaccination is very important, and each spotting set will always have 1 or 2 spots on vaccines. Second important section is nutrition. From nutrition also they will keep either 1 or 2 spots. Family planning methods also they keep 1 or 2 spots. Entomology also they will keep 1 or 2 spots. Water usually they keep 1 spot. Biomedical waste management they keep 1 spot. MCH also 1 spot. Meteorological environment 1 spot. Other spots like spot map, iceberg phenomenon, or web of causation. So whatever diagrams which are given in the textbook of Park, they can give you as a spot and 2 questions will be asked on that spot. So in this video, we'll just highlight about the first section, that is vaccination, and it is one of the very important section which is selected for selecting the spots. So usually 1 or 2 spots are always kept from vaccination. So if there are 10 spots, they will usually keep 2 spots. If there are 4 or 5 spots, there will be 1 spot on vaccination. So what are the types of questions which are being asked when the vaccine is kept? First of all, usual type of question is what is the type of vaccine? Write the schedule, dose, route of administration of this vaccine, or write national immunization schedule and at what time this vaccine is administered. Like in BCG vaccine, along with the vaccine, there is diluent. They will ask you what is the diluent for BCG vaccine. In case of hepatitis B vaccine, they will ask you what is the type of vaccine, what is the dose, what is the route of administration, what is the efficacy of the vaccine. Sometimes they ask storage of the vaccine. And very importantly, they ask about this circle. You can see here a circle of purple color and there is one square of white color. So this is called as vaccine vial monitor. In this vaccine also you can see there is a vaccine vial monitor. So they will ask you one question on VVM also. So what do you mean by vaccine vial monitor? What does vaccine vial monitor indicates? Sometimes they give the scenario like in a vaccine ampule, if the white square becomes the purple color, so what does it indicate? Like this, they will ask you. Then in BCG vaccine, they ask you what is the type of strain used for preparation of the vaccine. Then they may ask you about the BCG scar, then process after administration of the vaccine, what are the common complications due to vaccine, what is the storage of the vaccine in the refrigerator, in which compartment the vaccine is stored. Rotavirus vaccine also, they will ask you type of vaccine, dose, schedule, route of administration, efficacy of the vaccine, storage of the vaccine, complications of the vaccine. Now coming to next set of vaccines, that is measles or MR or MMR. So you can see here the color of the bottle is amber colored. So here also they will put the picture and they will ask you what is the type of vaccine. Write down the schedule, dose, route of administration, and site of injection. Site of injection is also very important in case of all the vaccines, including oral polio vaccine also. Now, there was a pandemic of COVID, so COVID-19 vaccine is also included in the list of vaccines. As measles vaccine is given at the age of 9 months, here also you can see that there is diluent. So they will ask you the diluent of measles vaccine. Diluent of BCG vaccine and diluent of measles vaccine are different. So you need to find out or remember correctly. Don't get confused about the diluent. Then strain also they ask you for measles vaccine. As measles vaccine is given at the age of 9 months, along with that, first dose of vitamin A solution is also given. So usually they keep one spot on vitamin A solution. In that, they will also ask you how much is the dose below 1 year and above 1 year. Then what is the schedule of administration? What is the name of the program under which vitamin A solution is given? Then therapeutic schedule, prophylactic schedule. These are the various types of questions which are being asked on vitamin A solution. So vitamin A covers in vaccination also and the section of nutrition also. Then Pentavac vaccine, which is included in the national immunization schedule. They may keep this and also they will ask the type of question like what is the type of vaccine, what is the schedule, dose, route of administration, and site of injection for pentavalent vaccine. Next is DPT vaccine. So here sometimes they ask you the contents and how much amount is present or what are the components in the vaccine also. Then same type of question like dose, schedule, route of administration, site of injection. In DPT vaccine, they ask you contraindication also, like if there is a reaction to the first dose of the vaccine, in case of second dose, pertussis component should be avoided. So they will ask you which part of the vaccine should be avoided if there is a reaction to the first dose of the vaccine. Then we have DT vaccine also. small d and capital T, capital D and D and capital T, DT vaccine also. What is the difference between these two when it is indicated? Very important vaccine is tetanus toxide. Even the lay people, they know about this vaccine. In ANC, we give tetanus toxide. So they will also ask you about the schedule, route of admission, site of injection, type of vaccine. Sometimes they may ask you to define toxoid. What is toxoid? Like this question may be asked. So tetanus, or they may give a scenario. One person gets an injury due to the rusted iron rod. What is what vaccine is given and what is the schedule of immunization against tetanus? So you have to remember the complete schedule of the tetanus toxoid vaccine. Then hip vaccine, meningococcal vaccine, like those who are going for pilgrimage or Hajj, they have to take the meningococcal vaccine. Nowadays, they are asking for three vaccines for the Hajj pilgrims. One is meningococcal vaccine, second is COVID vaccine, and third is oral polio vaccine. Then pneumococcal vaccine, typhoid vaccine. These are all other chickenpox vaccine. So many vaccines are available. So they may keep one of the vaccine and ask you these type of questions. I hope that you must have understood the vaccination section from where one or two spots are kept. And it is also very useful for in the Viva because in Viva also they ask you about the vaccines. So thank you very much for watching this video. Please note down the questions which I have told you and keep the answers right and revise them before you go to the practical exam. So all the best for your practical exam and thank you very much.